Good morning. My name is Josh Kennell,
And I'm Miki Harkins.
and our faculty advisor was Dwight Crable. And today we will be presenting our study, COVID-19 Protective Behaviors and Beliefs at Bethel College.
So as most of you already know, the pandemic was first declared by the World Health Organization in March of 2020. Our college did not return to having in-person classes on campus until the following August. In our research, we surveyed participants on various factors relating to the pandemic, such as things on mask behavior, beliefs on protective behaviors, and positive test results. And then we used our software to analyze this data. And then something important to note is that our research did include just people affiliated with Bethel. So with this being a small residential college in Kansas, the results could definitely look different had the survey been done in a different setting. We had many research questions that we were hoping to find answers to by doing this survey. We were curious if students had tested positive more times than staff and faculty, if they tended to wear their masks less often, if they were more skeptical about the virus, and possibly if that skepticism led to an increase of positive cases. We were curious if the way that people wore their masks affected their chances of catching COVID, if the number of COVID cases increased with perceived risk, and again, or also if strong beliefs about the effectiveness of protective behaviors led to a decrease of positive cases, and a higher score of self-reported knowledge also maybe led to a positive or decrease in positive cases.
As far as our procedure and analysis goes, we surveyed using questions inspired by a similar questionnaire from Johns Hopkins University Bloomberg School of Public Health and an organization called Vital Strategies. We had a total of 160 participants, including 100 male and 57 female, and then 71 faculty and staff to 89 students. So we were pretty happy with the roughly even good mix of representatives there. The online survey was open between November 30 and December the 21st of 2020 to all students and faculty. And it should be noted, this time in the pandemic was right before vaccines became a thing. If you can think back to that time. So we got composite variables for many of the factors that we were testing, and we did this by summing across individual questions. So we had a couple of questions for each variable. We summed them together to get the composite variable, and those include effectiveness, mask behavior, skepticism, and exposure. And it should also be noted our data had quite a few outliers and a rather skewed distribution. And so we used the Wilcoxon rank sum test to get a W statistic to analyze the data as opposed to a t-test.
So we first looked at positive test versus roll. And by positive test, we mean a positive test for the COVID-19 virus. And this was based on the participants' self-reports. And then we took roll at Bethel and divided that into two categories. So we have students in one category, and then the second category consists of staff, faculty, administrators, and coaches. And so as you can see in the table here, the students did have significantly higher positive tests when compared to that staff and faculty category. Then we looked at self-rated knowledge versus positive test results. And we can see in the table that participants who rated their knowledge as being very good had less positive tests than those who had rated their knowledge as just being good. Then when we compare self-rated knowledge to roll at Bethel, we can see that the staff and faculty category had a higher percentage of those who rated their knowledge as being very good. And so that could possibly indicate why they might have had less positive cases in students.
So using a mask or respirator in a public setting is associated with a lower chance of contracting COVID-19. Despite that, face mask use has been pretty heavily politicized throughout the pandemic. And so we were interested to explore this factor. So our survey question was, how often did you wear a mask in the following places during the first semester? And people rated on the scale of never to always this list of different places. We found that wearing a higher mask score did correlate with a with a less likely chance of a positive test. So the more you wore your mask, the less likely you were to test positive. These students did wear their masks less on average than the faculty.
Next, we looked at exposure, and so we obviously assumed with increased exposure comes a higher chance of catching the virus. So we had asked our participants to judge their own exposure by asking questions involving various situations below, in which they were to estimate how many times or how long they had been in these situations. And then when we look at the graph here, we can see that there is a higher exposure rating associated with more positive cases. And then on the left side of the graph, for the group that had said, no, I hadn't tested positive for COVID, they had much lower exposure scores. So this could indicate that with more exposure, there's a higher chance of catching the virus. And then when we compare exposure to the role at Bethel, we can see that the faculty and staff category had much lower exposure scores than students. And so again, this could indicate why they might have had less positive cases than students.
In addition to mask wearing being politicized, COVID-19 and other preventative strategies has been at the center of a lot of misinformation and politicization throughout the pandemic, especially early on in 2020. And so we were interested in exploring the skepticism on a scale of strongly disagree to strongly agree. We asked people to rate the set of 4 questions, common skeptical beliefs and attitudes. We found that a higher skepticism score was slightly correlated with a positive test, but as you can see, it was right above 0.05. Which is what we would normally consider significant. So it was just barely not significant. In addition to that, students were more likely to have skeptical beliefs compared to faculty and staff, and that was significant according to our tests.
So we did find a couple of factors that were not predictive of positive tests. One was a question that we had asked participants to judge their own perceived risk, and they were able to judge this on a scale of very low to very high. And then the second was a composite variable that we had created in which participants were to judge their beliefs on the effectiveness of COVID-19 prevention strategies. And this included things like masking, sanitizing surfaces, and social distancing. So here's kind of a list of all of our hypotheses that we had made prior to conducting any research with our survey. As you can see, most of the hypotheses were proven to be correct, but there were the couple at the bottom that were not. We found that students did have a higher percentage of positive tests, that they had a lower score in mask behavior, more skepticism about the virus, and with that skepticism came a increased number of positive cases. We found that exposure led to increased positive cases along with a lower score in mask behavior and a lower self-reported knowledge. And then, as I had mentioned previously, we hypothesized that with higher perceived risk, there would be more positive cases, and with stronger beliefs in effectiveness of prevention strategies, there would be fewer positive cases, but neither of these proved to be significant predictors of positive test results.
So our conclusion, what does this study mean? What did we find? Our research did show that health behavior related to COVID-19 protective strategies impacts health outcomes. This encourages mask wearing, social distancing, especially when community spread is high, as it was in the latter part of 2020. We also showed that self-assessment can be an effective tool for measuring health behavior and outcomes. But that being said, we should remember that our study design was not causative. We did not assign people to variables. We only gave a survey that asked people to reflect back on their behavior. So we should keep that in mind when analyzing the results. Also, we did not look at vaccines because we completed the survey right before those became widespread. Here are our references, and thank you for listening to our presentation.